I think it's easier than the sheet.
And the fact that I do think that it will increase the patient's compliance with the exercises.
It's a big advance compared to using sheets or towels or just what happens to be around. This is a device that's developed specific for this need.
Hi, my name is Mike Thomas, and I'm here today with Stanley Koch and Dr. Jeffrey Britton to introduce you to the FlexxZor, a brand new innovation in therapy support for patients recovering from knee replacement or knee sports injuries. Stan is a former knee replacement patient and the inventor of the FlexxZor. He'll give us a brief history of his experience and how he came up with the idea for the FlexxZor. And Dr. Jeffrey Britton will tell us how to use the FlexxZor and help us understand the importance of this new product. Stan, how was it that you saw the need for this product?
Well, as you said, I had replacement surgery on both knees about a year and a half ago. And when I went to the rehab center, I was issued a sheet and a towel to perform this range of motion exercise. Well, the sheet was hard to grasp and kept slipping off my foot, and it made it very difficult and very painful to use. I knew I needed to do the exercise, but the towel also was too much trouble. So I knew that if I needed and had to do the exercise, I had to come up with a device that would be stable on my foot. Giving it some thought, I went and purchased some material and created this device just for my own personal use. And it worked. And it worked so well that I now can go dancing if someone is willing to go with me. I thought that others should have the same advantage that I had in being able to use this product. We made some improvements, and here is the FlexxZor of today.
Doctor, please tell us exactly how does the FlexxZor work?
The FlexxZor is an orthopedic support device that is used to help a patient gain range of motion and flexibility after knee replacement surgery for certain types of sports injuries. It is made of soft fleece padding on the inside and tough, genuine pigskin on the outside. It has adjustable straps and a Velcro fastener for sizing. Today we will be demonstrating the use of the FlexxZor, and we will be discussing the advantages it brings to the range of motion exercise. First, let's look at how it is used. The FlexxZor is placed under the foot and then sized to the foot with the fold-over Velcro panels. Once it is in place, the patient either fastens the two straps together to form a single loop that he can hold with one or both hands, or alternatively, he makes a loop at the end of each strap, one for each hand. The length of each strap is adjustable. The exercise is performed while lying down, in a bed, or on a mat as we have here. Either way, you pull on the straps and attempt to flex the knee to the angle that the therapist has prescribed. You repeat the exercise as often as the therapist recommends in the treatment plan. Ultimately, the therapist is the best judge of frequency and use.
Doctor, what do you feel are the greatest benefits of the FlexxZor over the traditional methods in use right now?
As Stan Koch said, traditionally the patient has been given a sheet or a towel to wrap around the foot to pull on. Unfortunately, sheets and towels don't fit feet very well, and they often slip out of position or even off the foot entirely, and this can cause pain during the exercise. The FlexxZor is designed not to slip or change position, and it gives a much more stable, controlled exercise that is less painful. A second benefit is that the two straps can snap together to form a single loop, which allows the patient with arthritis to use his arms instead of his hands to support pulling of the foot if he wishes. A third benefit is the exact sizing of the FlexxZor, Patients may develop swelling after surgery, and the FlexxZor's easy sizing with the fold-over Velcro panels means you always get a perfect fit, whether the foot is swollen or not.
For me, the main benefits of this device was that it was much easier to use than a sheet and gave me better control, so I could do the exercise the same way each time, and as a result I experienced much less pain.
Stan, what about the durability and care of the FlexxZor?
Now the FlexxZor is really tough and is made of quality materials. It's easy to care for and can be cleaned with soap and water. It can even be machine washed and set out to dry if needed. Also, it comes with a full 1-year warranty against defects in workmanship and materials. I'm here with the therapist who took care of me while I was going through rehab and using the sheet and the towel. And Lori, since then I brought you over a sample of the FlexxZor. And how have you found it to be, and how have your patients found it to be?
It's a lot easier to use. They like it a lot better because it fits around their foot, and the fact that there's something for them to hold on to rather than pulling on the sheet, and that you have the loops, it accommodates their hands a lot better.
Do you find that they're able to do this range of motion exercise more efficiently?
Yeah, and they're able to take it back to their room because it's theirs to keep, and so they can work on it in the room. Therefore, they have better progress with the range of motion.
Thanks a lot, Lori.
You're welcome. My pleasure.
Thank you, Stan. And thank you also, Dr. Britton, for helping us demonstrate the FlexxZor. We'd like to thank everybody here at the Therapy Center. We hope that this demonstration will encourage you to try the FlexxZor and see for yourself the great benefits this product can bring to your patients. If you would like more information about the FlexxZor or wish to place an order, call this number, 866-907-4633. That's 866-907-4633. Thank you.